Well, it's wonderful to have the election or re-election of Patrice Harris for the Board of Trustees. She's been a great asset both in taking mental health and psychiatry, into primary care, into surgery, into the House of Medicine. So we're thrilled that this has really happened for us. But then there's some other things that are really exciting here. With finally the repeal of the Sustainable Growth Rate, SGR, it's time for us now to have celebrated it, which we have, and now it's time for us to really in psychiatry to once again become part of the House of Medicine and begin to look at some of those alternative payment methods that the House is beginning to discuss here, and that we in psychiatry and the AMA and all the specialties are going to have to work. How do we ensure that bundled cares, alternative work payments, all work together to ensure that our patients are the ones who get the best possible quality care in the system? And this delegation has been built over the last 20 years to get to the point where we have people on councils, now on the Board of Trustees. Hopefully we'll see more of the younger folk climbing also into other council positions and bringing their expertise to the House of Medicine so that the primary care docs and the specialty docs and the surgeons all understand that mental illness is everywhere. At least 30% of their patients have some form of mental illness that really in some ways hampers their getting really well for whatever they're seeing if they're not taken care of for their mental health needs. And I think that's the wonderful thing here. The other big issue is we know there's an opioid epidemic in this country. And clearly M.P.A, along with its AAAP, as well as with the addiction societies, are really working with the government and with all our specialties here and primary care to ensure that we get treatment for everyone around opioid addictions, to ensure that none of the medications are diverted. And I think that we are showing leadership, and they're appreciating us being in that field and helping them go through what we need to do for our patients. I think it's the fact that we're in the House of Medicine, that here we are a partner. And as we look at collaborative care models, this is essentially the AMA with all the different specialties, all the different states, sitting here and working on issues that affect each and every one of us, and more particularly our patients, at 320 million people that we all take care of in every way. And that's what makes this House special.